Rassik is different from other programs because we utilize a system called TROT, or Total Recovery Oriented Treatment. It's very simple. You can go to any provider and they will give you Suboxone or Subutex. And the Suboxone or Subutex, if it is in the correct dose, it will stop your cravings. But you have to ask yourself first that is that sufficient? The answer is no. We have to look at the reason why people take drugs. Some of them have been on pain medicine and are trying to come off the street drugs. Some of them have psychiatric issues and they're trying to deal with those, or they're hurting and they want to alleviate the pain. So they're taking the medication because it makes them feel good, it gives them a high, it helps their depression. There is another theory called the SMH theory, which is the self-medication hypothesis. And in that, what happens is that people are medicating themselves with street drugs because they have problems, they have symptoms. Instead of getting treated psychiatrically and getting those symptoms resolved, they end up taking street drugs because the end purpose is that they make them feel good. Rassik is different because we address all the issues. We look at the biological component, which is why you're using drugs. We look at the psychological component as to why or how are the drugs helping you with your mood. And we look at the social component. What is your social life like? Who do you hang out with? What do you do when you have spare time? When you tackle all these problems together, we can expect good recovery. Most of Rassik's patients follow this pattern, and I'm very pleased to tell you that we have a 90 to 95% recovery rate. That is how Rassik is different, that we cover the whole spectrum, not just one aspect.